All right. We do have a packed agenda today, so we're going to go ahead and get started. Thank you for coming today to office hours for the U.S. National Water Safety Action Plan. We're going to do a little bit of a mid-year update and hear from some of the states that are involved in developing their strategies. We've got Tessa Clemens from the CDC Foundation is going to share some information and then some kind of general overview things of activities that the plan has been involved in up to now this year, but then also kind of moving forward as well. This will be recorded or is being recorded, and we will post it to the resources page of our website as soon as the recording is available. So I'm going to go ahead and get started and share my screen. All right, Megan.
Thank you, Tina, and thanks everyone for joining us today. As many of you are probably aware, the CPSC held a hearing on the state of drowning in the US, particularly related to young children in backyard pools and spas. There were several of us involved in the National Action Plan in attendance, including Alan Korn and Lindsay Mondick and Justin Wiley from the Pool and Hot Tub Alliance, along with folks from agencies like Airbnb and independent safety organizations. The commissioner really wanted to hear what we felt could be, how we could help reimagine what the Pool Safely campaign could look like in the future, including the name of the campaign itself. There was a lot of discussion around the fact that drowning rates have either stayed the same or continued to go up in the U.S., and really trying to figure out how we can help the agency come up with a plan to drive that rate down. It sounds like they will be kind of putting their heads together internally to come up with some next steps and strategy and come back to members of the field like all of us to talk about how we can help with implementation. I imagine there may be another roundtable or another opportunity to provide feedback or to engage. And so, as much as we can, we'll certainly share with you all or ask that it be shared out with the wider drowning prevention community. Any questions? Did anyone attend virtually and have any questions or comments? Any feedback on how you thought that went? Okay. Well, we'll certainly keep you updated on what we hear from the agency or from the commission, I should say. And if there's anything we can share, we certainly will. Um, Tina, do you want me to take this next slide?
Yeah, if you wouldn't mind.
Okay, great. So, in conjunction with the ZAC Foundation this year, the U.S. National Water Safety Action Plan developed a Light It Blue campaign. We developed a toolkit that we shared with members of Families United and all of you who attend these meetings about how to get your landmarks, your skyscrapers, your Major League Baseball and NFL stadiums to light up blue for World Drowning Prevention Day. We had about 140 different locations report into us that they were lighting up blue for World Drowning Prevention Day. We were really excited about that. Most excited about the markets that then ran accompanying stories to really connect the dots about why those buildings were lit up blue, what it means to think about water safety and drowning prevention in your community. And so that for us was really exciting. We even had the Mets run a PSA about water safety and drowning prevention and why it should be important to everyone in that stadium that day. That campaign, along with lots of others in the US, were featured in the World Health Organization video for World Drowning Prevention Day that was shown a few days later in their seminar that they held. That video, I understand, will be available at the end of this week, and that will, enable you to really look at what's not only happening in the U.S. but around the country or around the world rather. So as soon as that video becomes available, we'll push it out to you all for use on social media or just even to brainstorm about what you could do next year for recognizing World Drowning Prevention Day in your community.
And I'll just add to, I think based on the response that we saw in the Light It Blue campaign this year, it's something that we will be very, um, it'll be easy to replicate next year. And I think based on the impact that it made and the visual impact that we've been able to make with the landmarks, I think it'll be a great addition next year to be able to kind of capitalize on the work done this year and expand on it. So. So for those who are interested, this is a QR code to the photo album that we put together when we submitted to the World Health Organization for World Drowning Prevention Day. So you can see all of the images that were uploaded, both from the Share Your Story campaign, from the Light It Blue campaign. Everything is available there. So feel free to peruse those as you like. As Megan mentioned, the World Health Organization will be posting their recap video. So if you want to, I don't know if you want to, we can screenshot this and capture the link. But as she mentioned, we'll share that information out as soon as it's live as well. But this is a QR code that will take you to the new technical packet that the World Health Organization has put out. Those of you, or some of you may have participated in that webinar that they hosted just following and just prior to and just following World Drowning Prevention Day, where they talked about the new technical packet. And so that is available following this link as well. All right, so with that, I am going to turn it over to Tessa Clements for an update from the CDC Foundation.
Thank you. So at CDC Foundation, we have a number of drowning prevention projects. They all are addressing various recommendations or national implications associated with the U.S. National Water Safety Action Plan. So I'm excited to provide an update. I know on previous webinar, I gave a more in-depth overview. So this will just be a sort of few what's new since that things. But we've been working really hard and I'm excited to have the opportunity to share some of that. So just as a reminder, our key focus areas for drowning prevention right now at CDC Foundation are around strengthening data. So we collaborate with state health departments to explore existing drowning data sources and use those data sources to better describe drowning, as well as create resources for ongoing drowning data and surveillance work. We also look at drowning prevention policies. So we're currently cataloging a number of drowning prevention policies, including backyard pool fencing policies, life jacket policies, and swimming and water safety education policies. And we provide resources for decision makers. So in addition to sharing and describing what the current state of policy, drowning prevention policy is in the US, we create resources like cost-benefit analyses and fact sheets that people can use in discussions with decision makers around drowning prevention policy. We also try to understand groups at increased risk of drowning in the US. So primarily in that arm of the project, we're conducting focus group discussions, and the goal is really to explore cultural, historical, structural, and systemic factors that might help explain those disparities so that we can identify, strengths-based and community-led drowning prevention interventions that will help address that increased risk. And then finally, we have a large scale swim skills training program where we provide grants to community serving organizations to partner with schools to provide basic swimming and water safety skills training, ideally during the school day. So I'll start with the Strengthening Data project to provide an update. But first, I'll also mention that these projects are happening in 11 states in the US. So the states that are shaded in blue on this map are the initial 10 states that we started in 2023. In 2025, we were able to expand to Hawaii. So all of the projects occur in these 11 states, but the policy projects cover all 50 states and the District of Columbia. And these states all have a relatively high drowning burden. In fact, about half of all fatal drowning in the country happens in these 11 states. So on the Strengthening Data project, where we are in terms of progress to date is we've completed the initial review of drowning data in several of those highlighted states and published reports. These reports cover sort of the current situation around drowning data and opportunities for collaboration across data systems, and also provide an overview of the burden and circumstances of drowning based on all of the available data that were collected. We have also been holding a webinar series associated with those findings from each of the states. So we've so far held webinars to launch the reports for California, Georgia, Michigan, and Alaska. And the recordings from those webinars are available on the CDC Foundation drowning page. So if you're interested, the QR code on this slide will take you there and you can view the recordings. And I'll also just mention that we'll be launching the Arizona drowning data report tomorrow at a webinar that's at 10 a.m. In Arizona or 1 p.m. Eastern time. So if you're interested, we would love to have you join for that webinar, or the recording will also be available on our site afterwards. I just wanted to share a few interesting findings from some of the reports that we've released recently. And so I think all of us who work in drowning prevention are aware that the circumstances of drowning and the characteristics of drowning incidents really differ by location. So of course, in Alaska, we see way different drowning circumstances than we see in Florida, although both of those states have very high drowning burden. And so one of the really important pieces of all of our data strengthening work is being able to get that local data so that partners can be informed around their drowning prevention activities. So some examples of those differences in Alaska, we see that drowning rates are highest among adults, adults around 35 to 44 years of age. So this differs from many states where the highest rates are among young children. And some interesting circumstances of drowning in Alaska are snow machine use. That's not a very common activity in many of the other states. We've also seen a lot of reports where substance use, alcohol or drugs were involved. And there's a lot more occupational related drowning in Alaska than we see in some other states. In California, on the other hand, drowning most frequently occurs in swimming pools, and we saw the highest drowning rates among children. And when we looked into data specific to child drowning with a little bit more information on circumstances, we found that in 89% of cases, there were insufficient barriers, so like pool fencing, for example, that could have prevented the drowning. 86% of the children were reported to not know how to swim when this information was available. In 75% of cases, there was no supervision at all at the time of the drowning. But when there was supervision present, half of those supervisors were impaired at the time of the drowning. So again, being able to access these more robust data sources have given us a better understanding that can lead to improved prevention strategies. In Michigan, we looked into drowning in the Great Lakes specifically because of available data there, and found that those are oftentimes caused by dangerous currents. And in Georgia, an interesting finding was that about 8% of drowning fatalities were motor vehicle crash related. So from cars entering water, for example, which of course have very different prevention implications than some of the other recreational drowning that we look at often. So tons more information in all of these reports. If you're interested, again, they are available on our site, and we're excited to continue releasing similar products for other states. I did also want to just mention quickly on that project that one of our key goals is to create a drowning data and surveillance toolkit that could be used by anybody in state or local health departments or other partners to analyze existing drowning data much more easily. So we're currently working on that resource, and we'll be pilot testing it with a number of state health department partners and others. And we'll look forward to launching that in the future. In terms of describing drowning prevention policies, we have completed the review of 2,557 pool fencing policies. They are at the local jurisdiction level. So within each state, there can be 300 different jurisdictions where the pool fencing policies need to be reviewed. We have 10 states, the initial 10 project states populated on the dashboard that you can access through the QR code on this slide. And we'll continue uploading. As I said, the policy project covers all 50 states. So we have the next batch of 10 states will soon be uploaded to that site. But some interesting findings are that about 15% of all the jurisdictions we've reviewed so far require a four-sided or isolation pool fence. And we know that there's really strong evidence that that four-sided fencing reduces drowning risk. So we would like to see this percentage be much higher. We also found that with the life jacket policies, mandatory wear ages range really dramatically across the states, from requiring life jackets only for people less than 6 years of age in some states, to children less than 17 in other states. So as I mentioned, this information is available in an interactive online dashboard that you can access via that QR code. And we also have resources that can be used for conversations with decision makers or other purposes there, and we'll continue adding to those. So for example, we just recently completed a national survey around residential pool access so that we can estimate the number of Americans that have access to a private residential pool, as well as what the fencing characteristics are around that pool, and their attitudes and behaviors related to pool safety. So we'll create resources once we complete the data analysis of that survey data and upload those on this policy site as well. And then on the swim skills training project, our goal there, again, is to support community-based organizations. These are often local YMCAs or other swim schools, to partner with schools to deliver basic swimming and water safety skills training. And what we're trying to do with this project is to understand how to best increase equitable access to basic swimming and water safety skills training. So there's a number of different models that we're testing and a ton of data that we're collecting. And so far we have provided grants to over 50 organizations and trained almost 40,000 children to date. We evaluate swim skills on the first and last lesson of the program. So we have a lot of data that we're analyzing associated with that evaluation. And we're developing a toolkit that will support these kind of partnerships. So for community-based organizations that are interested in partnering with schools, or for schools that want to get involved. And we're doing that with findings from both this swim skills training project, as well as those qualitative focus group discussion project that I mentioned, where we're trying to understand increased drowning risk. So that's my quick update. Lots of exciting stuff going on that, again, is very much aligned with the goals of the U.S. National Water Safety Action Plan. Happy to provide any additional information. And as I said, a lot of the resources are available on our site. Thank you.
Thanks, Tessa. Any questions for Tessa? All right. Not seeing any. Hope you all will participate in that webinar tomorrow with the QR code that she provided earlier. And we'll be sending out all of this information after the fact as well, because I have the links also. So we'll be able to share that pretty quickly after we're done. All right, so let's move on to some state reports so we can learn more about what's happening at the state level. We're going to start with Illinois and Laura Cochran. Illinois is kind of not even anymore in the beginning stages, Laura. You're kind of in the middle of it, right?
Right. Yes, thank you so much for welcoming me to provide an update on all of the progress that we are making in Illinois. We are about halfway through the two-phase process using the U.S. National Water Safety Action Plan Toolkit as our guide. And we have made it through reflection and completed a reflection summary as an executive committee. We're very excited to say that we'll be working with the leadership and support of the ZAC Foundation and in order to advance our action planning. And we're in the process right now. We've opened up our committees, and that is similar to what you might see as the key areas of the U.S. National Water Safety Action Plan. Our key areas are a little bit different to align with Illinois' strengths and also our needs. And we have currently 55, or actually, I'm so happy to say it's up to 59 committee members who have signed up to be part of this process and to drive our action planning forward. Many of our action planning committee members are in the fields of aquatics. We have many water safety professionals, foundations, advocates. We have members and professionals from agencies from across Illinois, and that really reflects our value of incorporating all of Illinois' 102 counties within this process. And right now we have about 10 Illinois counties that are reflected. We really want to increase that number. So if you are a person who is involved in water safety and drowning prevention, whether pediatric or adult, all the way through and across the lifespan, if you're working to advance this mission in Illinois, I'd invite you to become part of one of our committees for action planning. And I'll share I have an action planning survey I can share with Tina and the group after this meeting today.
Awesome. Thank you. Any questions for Laura based on Illinois' work? Thanks, Laura, for taking the time. I know you're popping in and out of a couple meetings, so I appreciate it.
Thank you for having me.
Of course. So let's move on to Texas. Dana, it looks like you're going to represent Texas today and share where you guys are at.
Yes, I am. Thanks so much. I'm here representing a lot of folks. Corey and Molly and Barbara Cozart and David Zane and Jillian Mitchell, the entire leadership team here in Texas. But yeah, I just want to give everyone a bit of an update. It was really cool to hear Laura's update in Illinois. That's giving me some thoughts on how we can move forward as well. So thank you for what you're doing, Laura. So we are really excited about the momentum that we're gathering in Texas. As you guys saw from Tessa's report, it's a big issue in our state. And we really kind of ground our work directly in the framework of the United States Water Safety Action Plan. So our mission is really straightforward. We are basically copying what we claim nationally, and our mission statement is envisioning a Texas where everyone is safe in, on, and around water. So, every initiative that we take, whether it's community-based or legislative outreach, it really aims to make that vision a reality here. So just to understand kind of how far we've come, we got to go take a look back. It starts all the way back to late 2022, and really Zach Foundation and Megan and Alyssa were instrumental in helping us get our initial gathering together, which happened in Austin in late 2022. And that kind of gave us the operational runway to move forward. We shortly after, in 2023, the LV Project, which is my organization, became the official fiscal sponsor for our coalition, and a core group of about 10 leaders began meeting on a regular basis to drive our projects forward. And one of the first things we got established, and I know this sounds silly, but it was a big deal, but we got our brand identity figured out. We intentionally named ourselves the Texas Water Safety Coalition because we felt like it was important to create consistency with other state coalitions across the country, California namely. We mirrored their logo. They shared all their information with us because we kind of feel like once we become a group of statewide coalitions, we want to kind of be local, but we want to feel national. So we mirrored California's logo with their clean typography and design structure, and we adapted it specifically for Texas with our iconic Lone Star inside the circle. So that kind of gives us instant recognition, both statewide and nationally, as part of a growing drowning prevention movement. The next piece is kind of putting boots on the ground. So we did three things. One, we created a Capitol presence. We organized and hosted our annual Texas Water Safety Day at the Capitol. We started that in 24. We continued it in 25 and 26. So we're keeping drowning prevention on our state lawmakers' radar. We launched our first official T-shirt line through a platform called Bonfire, which features our anthem of Texas Strong, Drowning is Gone. And then we also just this year launched our official website at txwatersafety.org. And we're excited about having an official digital home now. And we also, this is big news for us, we got our 501c3 status in May of this year. So hopefully that'll give us some stability, kind of cement us as a independent organization for the go forward. And then last but not least, I think really because of all these efforts, it's taken a while. It's kind of like what's that phrase that happens gradually and then suddenly? But it feels like we're really starting to get momentum. And we believe, probably because we're Texans, but we believe we have built the largest drowning prevention coalition in the United States in terms of a statewide initiative. We have about 240 active members that span 140 different organizations from really from border to border. And we have public health professionals, swim school operators, first responders, hospital networks, nonprofit advocates, families affected by drowning. So we've got a very diverse coalition, which we're real proud of. So we have two big things left, really for 2026, early 27. This is a big one. We are writing our first, I guess it's our second official water safety strategy, but it's our first as Texas Water Safety Coalition. Dr. Molly Johnson is leading the writing of that strategy, and it's very comprehensive, data-driven. It's going to define state-specific priorities and guidelines, and our calendar completion date is scheduled for January. So look for that, hopefully coming soon. And then formal governance. Now that we are an official independent nonprofit, we've put our call for nominations out. We're getting our official board together for our inaugural board of directors, which will transition our sort of makeshift board into a more solid board for the go forward. So, we've kind of come a long way, and we hope to keep going. I think the biggest accomplishments this year is getting our nonprofit status, getting the strategy almost done. We're very close, and we're real grateful to the national group just for kind of showing us the way. So that's it.
That's amazing. That is really, really impressive. Thank you, Dana, for sharing. Does anyone have any questions for Dana or for Texas in general and the work that they're doing?
This is Laura. I just wanted to ask if I can reach out to Dana. Dana, if I can contact you to talk about all of these great things you've accomplished. And I'd love to see that t-shirt.
We can make that happen. In fact, I'll put a link in the website. Yeah. No, it's been great because we're just able to kind of rally around the flagpole, We've hosted webinars and, just having a statewide email list is such a big deal, right? So, yeah, it's been helpul.
Hey, Dana, can I add something? It's Alyssa.
Yes, of course, Alyssa.
We are actively, Texas is actively fundraising as well to help sustain the organization. I think that's a really important piece. Once we got the 501c3 is figuring out how to get sponsors and support to figure out how to keep it sustainable. So I know that's something that we're working on. And hopefully going to have some success around, whether it be grants or corporate sponsors, individuals.
Yeah, it's probably not going to happen without that. So that is a critical piece for sure.
All right. Thank you. Thank you very much for sharing all of that. I appreciate it. And for the last minute step in. All right, so let's move over to Florida. I know Florida's been working on the strategy and getting that launched for a long time. You've now found a new home for where it's going to live, is my understanding. But let's, Natalie, do you want to take it from here?
Sure. I won't spend too much time, just to say that we have a very active task force. We have about 150 members and growing of different collaborators similar to Texas with local health departments, local agencies, swim schools, obviously Red Cross, YMCAs, local parks and rec. So there's a very collaborative approach to our task force. And we've created a task force that kind of trickles down to regional representation because, like most states, every region is very different. And so our focus is really not only from a statewide level to have developed the action plan, but to create localized action plans that really mirror what is needed, from a local perspective. And so what we're seeing is one county has already created theirs. There's another one, the county where Mickey Mouse lives. We're creating one in that region. And I think what we've done and what's been great with Florida is that we have this arm's length, no pun intended, with the Florida Department of Health and then the counties as well. And I'll let Rhonda jump in and kind of talk about how that has kind of organically almost created that capacity and that functionality for the task force. So if Rhonda, you can jump in and kind of talk about the historical journey of our task force.
Our very quick historical journey. Hi, everyone. My name is Rhonda Jackson. I'm the Violence and Injury Prevention Section Administrator at the Florida Department of Health. And we coordinate and Natalie and I co-chair that Water Smart Task Force, which isn't as big as Dana's, but we're trying really, really hard to get there. Dana, y'all are just impressive. Dang that Texas, we're always like, dang that Texas, they're doing the things. So congrats on that. And it's true, we have had our task force for a while, but the impetus has grown around the U.S. National Water Safety Action Plan and our implementation. And of course, Kirby has been a champion as well as Natalie. But we kind of experienced a twofold blessing in disguise when in 2024, there was legislation that required the Department of Health to implement a statewide swimming lesson voucher program. And so for those families that are certified eligible, we had to work through our 67 county health departments and identify swim instructors who would be willing to take the vouchers, and set up this process. And it was kind of like laying the tracks as we rode down the train, but it's worked really well. We continue to receive additional funds from the legislators, even during a time when so many are experiencing cuts. It's been an excellent way to establish additional Water Smart Task Force partners. And the bonus has been leveraging those relationships that have been formed among those key players in communities with our health department executive leadership in each of those spaces, because now they are willing to coordinate that local water safety action plan and implementation. So Natalie and I are kind of planning on doing a road show and facilitating from county to county just to ensure that there's consistency, that we can set that framework for them. And then at the state level, we're determined to make forward progress on building the comprehensive data dashboard that will also it's kind of based on our Florida health charts model. I'll drop that in the chat. But also, we're looking forward to CDC Foundation resources. Thank you, Dr. Clemens. And we're also hoping to host an in-person planning session that will assist us with really focusing in more on evaluation of our action plan efforts and identifying those key indicators that will work across multiple strategies. Since we have such a diverse population and every county is different, even though we have those set priorities, we know, that there will be multiple activities going on, but we want to make sure that we have a really good, solid foundation for our evaluation of making that impact locally.
Thank you for that. And based on what I'm hearing, we would love to be able to showcase on that action dashboard which counties have are in the process of or have developed locally based strategies so that we can share that out with the rest of the network. I think, as we look at the states and how well, in general, how folks are interacting with the US National Water Safety Action Plan, right? It's not always just about the states that are implementing strategies, which is obviously really fun to highlight the bigger efforts that are happening, but the local and community and county level efforts are equally as important, if not more so in the end, because they're directly impacting the individuals in which the communities in which they live. So we'd love to be able to highlight that work and showcase that work with others who are interested in going down that path so that they can connect the dots and maybe network and have those conversations to help move that needle a little bit as well. Kirby, did you want to share?
Sure, Tina. Hi. It's been a long process. As you said, we've been at this for it's just shy of 3 years since Tina Morgan and I held the first steering committee meeting to create the strategy. After we got involved with Megan and the Zach Foundation in February of 2025 at the National Conference, I can't give Megan and the Zach Foundation enough credit for basically steering the ship. I use the analogy for them that we're on the ship, we're going. They put Matt and Mike in charge, and they steered us into the harbor. And within about 3 months of them getting involved, we had our in-person meeting, and then at the end of May of 2025, and then in no time at all, the brains of the operation for me with my work wife Tina had the strategy drafted in about 6 weeks. So our strategy has been final for almost a year now. We ran into quite a few bureaucratic speed bumps, as it were. But the end result is that our strategy is going to be housed on Every Child a Swimmer with Casey McGovern. Casey stepped in and said, you can house it here. Tina and I met with her web designer about a week and a half, 2 weeks ago. And we're hoping, and the fingers crossed, is that it's going to be done within a month or two. I already have a saved email list that I am going to blast everybody that I know to say, by the way, it's launched. Please change my color on the dashboard, or our Florida color on the dashboard. Because the four of us, Tina, myself, Rhonda, and Natalie, have been putting in a lot of work. And it's more important than ever right now. And I say that because Florida is already at 90 fatal drownings this year. And we are ahead. At this time last year, we were at 86. And last year, we finished with the highest number we had ever seen with 120 at the end of the calendar year. I still don't have the vital statistics numbers, Tina, for 2025 yet. And Rhonda knows that as soon as her injury at the Alexis gets those numbers, she's going to let me know, because I want to be able to emphasize the importance of the need for the strategy. So, Miss Morgan, Tina Morgan, did I miss anything?
Hey there, everybody. Nope, I think you covered it. We are just very much looking forward to getting that little button on the map turned green. So thank you guys.
Happy to hear there's motivation for that color change. Sometimes Tina and I are doing things on the back end and we wonder if anyone notices.
Oh, I notice all the time. I want you to update the strategy that Natalie was alluding to earlier is Osceola County, which is adjacent to Orange County. And to give you contextual, Orange County is Orlando. Osceola County is Kissimmee. And they have Disney mashed in between the two of them. So that gives you guys the mouse and the context there. Orange County's plan's already done, with credit to Megan again and the Zach Foundation to get Orange County's plan done. And Natalie is going to be spearheading the effort in Osceola County. We had a meeting this morning that we were at. So we're looking forward to it. If I have anything to say about it, I'm going to push Broward which is Fort Lauderdale, South Florida. I'm actively involved with their water safety coalition that's been in place since 1997. And I'm going to push the head of the drowning prevention program for DOH down there to say, by the way, why don't you get the community plan together since you're doing all this work already? But thank you for listening. Appreciate it.
Yeah, no, thank you for the update, all of you. I know you've been working hard and continue to do so. So thank you for that commitment to the work, and for sharing the information with us all. Appreciate it. Okay, so that's for updates. That's kind of a wrap, which we ended up that part a little bit earlier than I expected, which is awesome. Thank you all so much. I am going to just put on the screen here the upcoming engagement opportunities that we have available, just so that you can see what's coming next. Obviously, we continue to have state office hours on a monthly basis. And one of the things that we're coordinating with Alyssa Magrum right now is we're going to do kind of a look ahead to Rio in November, or Reno, sorry, in November, with regards to the International Aquatics and Water Safety Conference. One of the things that I think is really special about these relationships is that we can showcase and highlight the things that you can look forward to. We, as the national plan, have submitted a couple of sessions. We know there are multiple sessions in the drowning prevention track that folks will be interested in. And so we want to make sure that you're aware of those. And then any other opportunities that make sense for you, so that you could really start thinking about planning out your activities and your calendar and your timetable and your availability at the conference. As much as we all like to meet and greet, it gets busy. And so the more that we can do that on the front end before we get on site is going to be really, really helpful. So we're really excited about that opportunity. The other thing that I'm working on right now is our November webinar. And we're really hoping to look at kind of this national organization with community level impact and engagement levels. So I'm working on a couple of relationships right now, and individuals to try and make that connection and be able to share that information with folks that will be really beneficial from an activation standpoint. And then for those who haven't already that are interested, there is still the opportunity to participate in the Drowning Prevention Research Interest Group. So this is part of SAVER and Safe Kids Worldwide. They're connected to the strategy and the national plan in this way from the research perspective. On the website, on the resources page, there's a link for those who are interested in participating. You can sign up there. And the next meeting will be on November the 17th. They just had their most recent meeting. I believe it was yesterday. So there's plenty of time in advance if you're interested in that particular space. Connie, anything else that you want to share as the steering committee chair on opportunities or things that are coming up in the near future?
No, I think you've done a great job here, Tina. Thank you.
All right. So one of the other areas that many of you have been involved in the past is working groups. Certainly that's something that we're looking at going forward as well. And so we're finalizing our plans for what we're considering 26, 27 at this point, and the spaces that we're going to be working in, and how we're going to move forward with facilitating those working groups. So more information to come on that for those who have participated in working groups in the past. So as I mentioned, we will be sharing all of this out after the recording is complete. And I'll make sure and share any of the links that were added to the chat, any of the links that were shared, whether it was my screen or someone else's screen, then we'll make sure that you have access to those. But now that we do have a little bit of extra time, and it is still office hours, wanted to open the space up for you all for questions and answers and, conversation. So I'll open the floor to you all. Alyssa?
Sure. Thanks, Tina. Just a quick note I'm really excited about the November 18th conversation we're going to have about the conference. And I do wish it was in Rio and not Reno, actually, but maybe that's a future location. But I did want to let people know that we had some over 50 submissions for the Drowning Prevention Track conference for about 22 spots. So we are also going to be hosting a poster session opportunity. So if and which I think it would be really great for some of the the data and some of the state reporting. So watch for guidelines on how to submit for that poster session if in the coming weeks. And if sessions that are not chosen for breakout sessions, we'll get the opportunity to also submit for that. So just that's an exciting piece. And I know Natalie's on here. Natalie's going to be part of helping us review the sessions that get submitted for the poster. So just letting people know that that's an upcoming opportunity in addition to the breakout sessions of the conference.
Great, thank you so much. Any other opportunities? I mean, everyone on this call right now is involved in multiple spaces. So if there are any other resources or opportunities for engagement that you all know of that you want to share, please feel free to throw it into the chat or to share it with the group.
Tina, Dana here. I was at a conference called Switchback. It is an outdoor recreation conference. It has vendors like Coleman and the hiking shoes and all that. It was more of a retailer conference, and it was put on by an organization called the Outdoor Industry Association. And I was looking at their report, their annual report, and in that annual report, they had photographs of a kid jumping off of a rock into an open body of water with no life jacket. They had adults in a kayak with no life jackets on. And that industry is very geared towards, I guess, like water activities, but more so hiking and things like that. But they're heavily funded. They have a big contingent of heavily funded board members and members. And when I looked at their report, I asked them, I said, what do you guys do in the way of safety? Like, how do they're like, well, look around. There's gear everywhere. There's bear spray for the hikers, and there's, all the helmets for the cyclists. And, I said, well, I just want you to know that on the water safety side, there may be some gaps here. And so we ended up having a very good conversation, and it really got me thinking that it would be so great if we in this community could bridge the gap and start. They basically said, do you think you know anyone who could help us maybe implement a safety session into our program? And I said, yeah, I think I might know some people. So I just feel like there's a real need for us to start being the sidecar to the fun, because that's kind of what safety is. It's never the destination. It's always just the sidecar on the motorcycle, which is the dangerous thing. So I just wanted to mention that because I feel like there's a real opportunity for us as a group to get involved with bigger organizations like that.
I agree, Dana. I think that so often we're talking to ourselves at these conferences, and it can be hard, at least I find for myself from a professional standpoint, to lift out of the day-to-day to look for those types of opportunities. So maybe there's something that we could do from a analysis perspective, sort of look at all the opportunities for engagement or presentation and pursue them. Maybe Tina and I will reach out to you offline to try to figure out how to figure that out.
Let's do that. I mean, to the point where I'm making budget decisions for 2027 on conferences to go to. And because I feel really blessed to know everyone, pretty well in this group, I feel like my money might be better spent in terms of life jacket awareness by going to some of these conferences where I don't know anybody. So I would love to talk to you guys about that and see if there's anything that we could maybe put in front of them together to say, hey, while you're putting a session together on outdoor water sports, have us come alongside you.
I would love for the NEPA to be part of that conversation too. And I think if we could have like a traveling roadshow team that goes to some of these conferences that are outside of our direct space. I completely agree with both of you. We're often in our own echo chamber talking to ourselves. And I think the way we're going to move the needle is to get out of it. Obviously, we have to talk to each other for sure and work together, but what a great opportunity.
Yep, I agree.
Awesome. I'll follow up with an email so we can all connect. Anything else that anybody wants to share or talk about today? A few minutes left.
Well, regarding the conference, when I worked in athletics, in collegiate athletics, many years ago, I attended the Athletic Business Conference. And last year I submitted a session, thinking, hey, let's get some water safety, drowning prevention education in athletics, right? Like that direct correlation. So I am presenting, and it happens to be in Florida this year. So I am presenting at Athletic Business. Their show is in November in Orlando. And that's a completely, new slash different audience, which is really interesting. And, they have about 3,000 plus participants. I mean, it's just a different mindset and a different lens on how they approach swimming, right? So that's another good one is perhaps athletics. Athletic business. I can definitely provide you guys with some feedback on how that sort of went. My session for that one is specifically how to bring drowning prevention education into the aquatic environment in a university setting. And interestingly enough, we got a grant from Step Up to Swim. We're working with a local university here called Full Sail University, and in collaboration with the city of Orlando, we're going to be providing virtual water safety education to all the students that sort of participate, and then also swimming lessons to Full Sail University students. So there's that. We are very focused on children under the age of 5, but we know that even in Florida, the numbers are still very high in that adult segment of the population. So yeah, tapping into sort of that segment of the population is going to be interesting.
Hey, Tina, one of the things that I wanted to mention, I've gotten to know over the last couple of years a mother out of South Florida who lost her 17-year-old son in a tragic accident where they were out walking their dogs at about 10:30 at night, watched a car drive into a lake. Her son, Aiden, said, "Mom, I'm going in." He dove in and he struck a boulder as soon as he hit the water and instantly died. And I've gotten to know her since I met the head of the DOH's drowning prevention program in February of 23 when I was in Colorado Springs. And since then, I've been a part of the Broward Coalition. And Sarah has been a part of it, and I've got to know her since then. And recently, she had somebody approach her. Turns out that this individual lives in Sunrise, Florida, which is outside of Fort Lauderdale, and he's a documentarian. And he's a runner, and he was out and he saw the cross at the lake, did research, and is doing it at no cost for Sarah to tell her story. And the preview, anybody that's going to be in South Florida, I don't know if Connie's going to be down there or not, but they're previewing the documentary at the end of the month. And since she's gotten to know me, she actually asked me to be interviewed by the director and the producer to be a part of the documentary to provide the perspective on the data side of things in Florida and the importance and the need for water safety. And it's called Throw Don't Go. And Sarah has created a foundation in her son's name called the Aiden Perry Life Ring Initiative. And she has been on a determined mission to get the life rings distributed to every single community that she can in Broward County, where she's located, as well as throughout Florida. And so if anybody happens to be in South Florida, I talked my wife into it. I'm driving down. It's about a 3.5 hour drive for me, but they asked me to be there, so I am going to be there as well. But it's all about getting the word out there. So I'm going to drop the promo poster that they sent me for it, so you have an idea of what it looks like.
Kirby, when is this going to be available and where, do you know?
Um, it's I know the preview. When I did my interview last Tuesday, I was talking to the director and the producer about it, and he said it's called a preview at the end of the month because if they called it a premiere, they wouldn't be able to enter it into the season 4 release. And I asked him, I said, where's it going to be available eventually? And Kirk indicated to me that more than likely Netflix, because it's going to be a shorter a documentary short, about an hour long. But I am definitely going to find out where it's going to be, readily available. End up on Hulu, Amazon, whichever one of the platforms, or multiple. I don't know. When I see them in a couple of weeks, I will see if I can get any more details about the release schedule. And if I find out, I'll pass it along.
That'd be great. Thank you. Dana, did you have something?
I just had one more quick thing. Kirby kind of sparked something with that documentary. That's an amazing story. And Kirby, if there's ever an opportunity to connect with that mother, I would love to do that.
I can put Sarah in touch with you, Dana, definitely.
I really admire what she's doing, but I don't know if anyone have you guys heard of the documentary When Everyone Swims?
Natalie did a preview in Orlando a couple of months ago.
Okay, good. I need to host a screening here too, but I just think it's a really profound piece of work by a documentarian who's actually an Emmy Award winner, or I don't know, some kind of one of those big award winners. But he talks about the need for everyone to know how to swim, talks about some key issues that we're all familiar with, including like lack of public pools and the disparity in drownings among races. And so I just thought I'd put this on this call on the radar because I think it would be amazing to have a screening maybe at a conference or at a national water safety conference because it's right in our wheelhouse. So I just wanted to mention it.
So I've been approached, Dana, to screen that at the conference. Again, I don't have the ability to say yes or no within the conference. I can't make that decision independently, but if people are interested in that, please send me an email because I think the more interest that I can show in having that screen at the conference, the chances are that we could actually make it happen. So if others are, I'm happy to bring that forward to the AOAP.
I can tell you, Gerald Hartness, who is the documentarian, is like amazing. And I think I think it would be really great for everyone to see it. So I'll definitely participate in that email campaign.
It was excellent.
Yeah.
It was excellent, man. And just to let you know, I don't know if Tina or Megan knows this, but Bill Ramos was interviewed.
Yeah.
He was in that because I didn't know that ahead of time. And I'm sitting there watching and I'm like, I know him. I'm like, I know that guy.
It's really interesting. This conversation is really interesting because I actually have scheduled an interview with Gerald because he and I have been talking, basically since I screened it in April. And I think, Dana, you're on that list.
Yeah.
Yeah.
They were so kind to include Connor's story because Connor is
exactly.
a teenager in an open water drowning, but they flew down here to my home right here and they were amazing. Good people.
Amazing. So yeah, I have a scheduled, we're going to be doing an interview. I believe it's the 27th, and then I'll share clips of it on social media as well as YouTube. And then from that interview, I'll be writing an article. And so that, Alyssa, may also help you. You can use those assets once the interview is done, right? So it's perfect timing. There you go.
Yeah, and that would be great, Natalie. Maybe you and I can approach Julian together and see if we can. I don't know where to fit it at the conference but I feel like it would be a really great opportunity as a, even if it's an evening thing. So let's chat about that.
For sure. As a more introvert, like I love the socials, but sometimes I'm like, oh God, I don't know if I can handle another social. But I'm
Yeah,
very,
I know. So I think it does. I think it would lend an additional
yeah.
activity. So let's move that forward. You and I can
Awesome,
chat
Melissa.
offline. Okay.
Okay.
Awesome. Love it. I love the connections. This is what office hours is supposed to be about, right? So thank you. We're at just over the hour, so I want to just say thanks to everyone who shared information today. We'll get the information out to the rest of the network here probably early next week, and really appreciate your participation and your continued work in the space. Thank you very much.
Have a
Thanks,
great
everybody.
rest of
Have
the
a good
month of
day.
August, everyone.
Thanks,
Bye.
Tina. Thanks for leading us here.
Thank you.